Leaders of several religious groups are urging Christians and non-Christians alike to accept the COVID-19 vaccines. They were speaking at an event organized by Health and Wellness Minister Dr. Christopher Tufton at the Jamaica Pegasus Hotel in New Kingston as part of the government's countermeasures against vaccine and COVID-19 misinformation. Melvin Pennant reports.
The church leaders are arguing that vaccination against COVID-19 is a health issue and not a religious one.
Everything rises or falls on leadership, and I am of the firm conviction that leaders should lead from the front. And that's one of the reasons why I took the vaccine. I also took the vaccine simply because I believe in looking at the data, and I believe in doing research and looking at what is measurable before making a decision. So I am here today with my ministerial colleagues to say to us that we have come to encourage Jamaicans to examine the data, to do your research, to check with your medical doctor, and to consider seriously taking the vaccine.
President of the Jamaica Evangelical Alliance and Senior Pastor of Hope Gospel Assembly, Reverend Dr. Garth. Reverend Garth, in giving his approval, was critical of other religious representatives who have anti-vaccine sentiments.
I have been bombarded every day by persons who say to me, my pastor told me, if I take the vaccine, it means that I'm putting my faith and trust and confidence in the vaccine. That's very sad. Because, the Word of God says that faith comes by hearing, and hearing by the Word of God. And salvation, in and of itself, is not a matter of feelings. There are three coaches, and the number one coach is actually facts.
President of the Jamaica Union Conference of Seventh-day Adventists, Pastor Everett Brown, says his church have always been people of science and healthy living.
As a Christian and as a citizen of Jamaica, I have a moral responsibility to encourage my fellow Jamaicans and members of the Seventh-day Adventist Church to take the vaccine. I do this because the Seventh-day Adventist Church, prior to COVID-19, have always encouraged the members of the church to live healthy, to practice the basic laws of health, but recognize that disease is rampant in our community and around the world, and hence when one is infected or affected, one ought to seek medical help.
Anglican Bishop of Jamaica and the Cayman Islands and the head of the church in the province of the West Indies, Howard Gregory, says they are on board, but it takes a community to stop a pandemic.
I want to appeal also to religiously committed persons, but also to our nation, to think in terms of our responsibility to ourselves, but also to our community. Our Christian faith speaks to our love of God, but also our love of neighbor, our social responsibility. One of the things we are wrestling with at this point is what is the implication of vaccine hesitancy for our children and their return to school. We need to think seriously about how inaction and the consequences of this for our children. We need to think also of the consequences for others. This country will not be able to see its economic life return to vibrancy until persons, and a much larger number of persons, take the vaccine. So that is something that we need to pay attention to.
Head of the Roman Catholic Church, Archbishop Kenneth says Jamaicans must take the responsible approach in their response to the crisis.
The facts are before us. The positivity rate is increasing alarmingly. More persons are falling seriously ill and dying, and the health services are overburdened, especially by COVID sufferers who have not been vaccinated, In addition, our regular worship, work, and school routines have been further curtailed. As the situation worsens, I unite my voice with all church and other leaders in support of the Ministry of Health, that Jamaicans view it as a serious moral obligation to protect others as well as themselves in this great danger of the virulent COVID-19 SARS-CoV-2.
President of the Jamaica Council of Churches, Rev Newton Dixon, says the trend towards the virus is changing, but it is not fast enough.
What is the most reliable way of returning to a productive and hopeful social setting? We believe the answer to that question is a population that has sufficiently protected itself against a virulent, powerful, and lethal virus. And so it seems to us in the Council that the answer then, in addition to maintaining social distancing, wearing masks, and sanitization, it seems the best option is the vaccination. And so we commend to our people the understanding that we are interconnected, our interrelatedness as human beings and as Christians, that understanding demands we act in the interest of the common good.
Dr. Tufton, in his comments, says the voice of the clergy in hammering home the necessity for people to get vaccinated was even more critical, given the increase in deaths, hospitalizations, and the illnesses. Melvin Pennant, PBCJ News.